The hidden neck bone skeleton is formed by the neural crest cells, the blue color. Here, the frontal, the nasal, lacrimal, zygomatic bone, maxilla, mandible, and the squamous temporal and the sphenoid, and also the hyoids formed by the neural crest cells. The paraaxial mesoderm from somites forms the parietal bone, the occipital, and the petrous part of the temporal bone, petrous temporal bone. The lateral plate mesoderm, the yellow color, gives origin to the laryngeals, form the laryngeal cartilages. The paraaxial mesoderm, or the somites, form the skeletal muscles of the face and neck, the dermis and the connective tissue in the dorsal head, and part of the skull base. The neural crest cells form midfacial skeleton, pharyngeal skeleton, part of the skull base, and dentin, odontoblast, the sensory neurons, and the glandular stroma. The lateral plate mesoderm forms the laryngeal cartilage and the connective tissue. Laryngeal cartilage and connective tissue. Let's talk a little bit about the ossification of the skull. We have the intramembranous ossification. Firstly, primary ossification centers formed, spicules, and the intramembranous ossification is seen in the calvaria. In the calvaria, the frontal parietal bone, squamous part of the temporal bone, and the occipital bone. And also, it's seen in the some of the facial bones, nasal, the lacrimal bone, the maxilla, zygomatic, palmar, and palatine. As you see here, these are the bone spicules, primary ossification centers, for the frontal bone, for the parietal bone, and the occipital bone, part of the occipital bone. The second type of ossification is the cartilaginous ossification, and it begins in cartilage, and this forms the base of the skull, as we see here in this inferior image. We have a look at the base of the skull, the occipital parts of the occipital bone, the sphenoid bone, the ethmoid, the petrous part, mastoid part of the temporal bone, the mandible, the malleus, incus, and stapes. Malleus, incus, and stapes, these are three bones found in the middle ear. The inferior nasal concave, also by cartilaginous ossification, and the hyoid bone also ossifies through cartilaginous ossification, and the mandible has both types of ossification, the intramembranous and also cartilaginous. Now let's move into a new title or a new topic, which is pharyngeal apparatus. In the pharyngeal apparatus, it consists of pharyngeal membrane, the pharyngeal arches, the pharyngeal pouches, and pharyngeal grooves and clefts. This is the lateral view of embryo here, and you see here the stomodium, which is in the future gives into the mouth, and then we have 1, 2, 3. These are the pharyngeal arches. Okay. In this image, which is in upper here, we have the embryo, and doing this section, we will see this image. In this image, we will see the difference between the pharyngeal cleft pharyngeal pouch and the pharyngeal arch. You notice this region. Here we have these arches. These are the pharyngeal arches, consists of core of mesoderm. From outside, we have these grooves. These are pharyngeal grooves or clefts, and they are covered by ectoderm. So in the pharyngeal cleft, we have ectoderm. In the pharyngeal arch, we have mesoderm. Here, these are the pharyngeal arches. And here from inside, we have this region is the pharyngeal pouch, and it's lined by endoderm. So pharyngeal pouch lined by endoderm, pharyngeal cleft from outside is lined by ectoderm, and in the middle we have the pharyngeal arch, which is composed or consists of a core of mesoderm, and it gives origin to the bones, muscles, nerves, and vessels of the head and neck. Each pharyngeal arch consists of a core of mesenchyme, which gives origin to bone, muscle, nerve, and vessel, and is covered externally by ectoderm. Here, this blue line is the ectoderm, and internally by endodermal epithelium, this yellow color. So the pharyngeal cleft from outside, pharyngeal pouch from inside, and in between we have these pharyngeal arches. The pharyngeal arches, as we have mentioned, they give origin to the skeleton, the bone skeleton, and the muscles, the nerves, and the vessels. In here we will talk about the skeleton. And in the skeleton, the first arch gives origin to Meckel's cartilage, and the Meckel's cartilage gives origin to the maxilla, mandible, zygomatic bone, the malleus and incus, and the sphenomandibular ligament. Let's see in the right side image, we have the maxilla. This is the former site of first arch, Meckel's cartilage. It forms the maxilla, and the sphenomandibular ligament, in the zygomatic bone, region of the zygomatic bone here, and the malleus and incus. These are the auditory ossicles found in the middle ear, malleus and incus. Okay, the second arch is called gives redshirt cartilage, and this ossifies to form the stapes of the middle ear, the third one of the auditory ossicles. They are three: malleus, incus from the first arch, and the stapes from the second arch. And the styloid process, the stylohyoid ligament, and the lesser horn and the upper part of the body of the hyoid bone. All of these, they come from the second pharyngeal arch. The third arch gives cartilage which ossifies to form the greater cornea and the inferior part of the body of the hyoid bone. This region given by the third arch. Then we have the fourth and the sixth pharyngeal arch. Cartilages fused form the laryngeal cartilage except for the epiglottis. The fourth and the sixth pharyngeal arches, arch cartilages, they fuse to form the laryngeal cartilages. The fifth one disappears. Now we will talk about the muscles given by the pharyngeal arches. The first pharyngeal arch forms the muscles of mastication, which are the masseter and the pterygoid, the mylohyoid, the anterior belly of the digastric, the tensor tympani, and the tensor veli platini. This is the masseter and the mylohyoid. The second pharyngeal arch forms the stapedius, the stylohyoid muscle, and the posterior belly of the digastric, the auricular and muscles of facial expression. So the muscles of the facial expression, the auricularis, the stylohyoid muscle, and stapedius, they are formed by the second pharyngeal arch. The third pharyngeal arch forms the stylopharyngeus muscle from the styloid process to the pharynx, stylopharyngeus. The fourth pharyngeal arch forms the cricothyroid muscles, the levator veli palatini, and the constrictors of the pharynx from the fourth arch. The sixth pharyngeal arch forms the intrinsic muscles of the larynx. So the intrinsic muscles of the larynx are formed by the sixth pharyngeal arch. Now we'll talk about the nerves of the pharyngeal arches, the maxillary and the mandibular branches of the fifth cranial nerve 5, which is a trigeminal nerve, supply derivatives of the first pharyngeal arch. As you see in the right side image here, V means cranial nerve 5. The cranial nerve 5, the maxillary and the mandibular branches, they supply the derivatives of the first arch. The second arch is supplied by facial nerve, cranial nerve 7. As you see in the image A, the facial nerve supplies the second pharyngeal arch. The glossopharyngeal nerve supplies the third pharyngeal arch, as you see here, and the fourth arch by the superior laryngeal branch of the vagus. Superior laryngeal nerve supplies the fourth pharyngeal arch, while the recurrent laryngeal nerve, the recurrent laryngeal branch of the vagus nerve, supplies the sixth pharyngeal arch. So the fourth and sixth are supplied by the vagus, the fourth by the superior laryngeal branch, and the sixth pharyngeal arch by the recurrent laryngeal branch. As we see here, we have the nasal cavity, the tongue, sublingual, parotid and submandibular glands. We have the pharynx and lower down the esophagus and the larynx. Each corresponding structure is supplied by its corresponding nerve that supplies the corresponding pharyngeal arch. All the derivatives of the first pharyngeal arch supplied by the maxillary and the mandibular branches of the trigeminal nerve, and the derivatives of the second pharyngeal arch supplied by facial nerve, the derivatives of the third pharyngeal arch in the stylopharyngeus muscle supplied by the glossopharyngeal nerve, and derivatives of the fourth pharyngeal arch supplied by the superior pharyngeal branch of the vagus nerve, and the recurrent laryngeal nerve supplies the derivatives of the sixth pharyngeal arch. Branchial arch derivatives, branchial or pharyngeal. It is the same name for the pharyngeal arch is branchial arch derivatives. Here we have in this table the arch, and here the cartilage derived from the arch, the muscles, the nerves, and if there is any abnormalities in the development of these arches. The first arch gives Meckel's cartilage, which gives the mandible, the malleus, incus, and the sphenomandibular ligament. And you notice that the derivatives starts with M. The muscles by muscles of mastication, temporalis, masseter, lateral and medial pterygoid, mylohyoid muscle, anterior belly of digastric, tensor tympani, tensor veli palatini. The cranial nerves that supply first arch are the maxillary and mandibular nerve, branches of the trigeminal. The abnormalities related to this arch is Treacher-Collins syndrome, which is the first arch neural crest fails to migrate, and this will result in mandibular hypoplasia and facial abnormalities. The embryo or the fetus will develop mandibular hypoplasia and facial abnormalities. The second arch gives Richard's cartilage, which gives steps, styloid process, lesser horn of the hyoid, and stylohyoid ligament. The structures or the derivatives starts with S. Stapes, styloid process, stylohyoid. The muscles given by the second arch, muscles of facial expression, the stapedius, the stylohyoid, and the posterior belly of the digastric. These are supplied by the facial nerve. Okay. The third arch, the cartilage ossifies to give the greater horn of the hyoid. The muscles given by the third arch is the stylopharyngeus. Think of stylopharyngeus innervated by glossopharyngeal nerve. So stylopharyngeus innervated by glossopharyngeal nerve. So this is the third arch, and it's supplied by glossopharyngeal nerve. The abnormality related to the third arch is a congenital pharyngocutaneous fistula, persistence of cleft and pouch, resulting in fistula between the tonsillar area cleft and the lateral neck. Okay, this is called congenital pharyngocutaneous fistula. The fourth and the sixth arches gives cartilages that have thyroid, cricoid, retinoids, corniculate, and cuneiform, and these are the laryngeal cartilages. The muscles given by the fourth arch, most pharyngeal constrictors, the Greek thyroid muscle, the levator veli palatini, while the sixth arch gives all the intrinsic muscles of the larynx except the cricothyroid, which is given by the fourth arch. So the nerves that supply the fourth arch is cranial nerve 10, which is the vagus, by the superior laryngeal branch. So the superior laryngeal branch of the vagus supplies the fourth arch, while the sixth arch is supplied by the recurrent laryngeal nerve, the recurrent laryngeal branch of cranial nerve 10, the vagus. What are the abnormalities related to the fourth and sixth arches? Arches 3 and 4 form the posterior 1/3 of tongue. This is a general comment on the fourth and sixth arches. The arches 3 and 4 form posterior 1/3 of the tongue. Arch 5 makes no major developmental contributions. Usually disappears. So this table summarizes the branchial arch derivatives or the pharyngeal arch derivatives. What about the pharyngeal grooves or clefts? They separate the pharyngeal arches externally. These are from outside. We have the pharyngeal clefts or grooves. Only the first pair persist at the external acoustic meatus or ear canals. External acoustic meatus or external auditory meatus or ear canals, the external ear. This, as we see in this image, the external acoustic meatus. comes from the first pair of pharyngeal grooves. The other grooves lie in a slit-like depression, cervical sinus, as we see here. Second, third, and fourth, they form cervical sinus, slit-like depression called the cervical sinus, and they're normally obliterated along with the sinus as the neck develops. They obliterated, as we see, as the neck develops, the cervical sinus disappears. What about the pharyngeal pouches, which are found from inside or the endoderm of the pharynx, lines the pharyngeal arches, forming diverticula called the pharyngeal pouches. As we see here, on inside we have these pouches. The first pharyngeal pouch expands into an elongate tubotympanic recess. This is the first pharyngeal pouch, and it elongates to form tubotympanic recess, which will form the tympanic membrane, eardrum, and the tympanic cavity, and mastoid antrum, and also the auditory tube. The second pouch here forms the tonsillar fossa, the palatine tonsil, which is a mesodermal tissue. So the second pouch gives the tonsillar fossa and the palatine tonsil. And we have here the tonsillar sinus. So we have talked about the pharyngeal arches, the pharyngeal grooves or clefts, and the pharyngeal pouches. The third pharyngeal pouch, the third one, what does it give? The third, this is the first, and this is the first, we said give the tympanic cavity and the mastoid antrum, the auditory tube. The second gives the tonsillar fossa and the palatine tonsil. The third one, it has dorsal part and ventral part. The dorsal part forms the inferior parathyroid gland, while the ventral part forms the thymus. And the developing thymus and parathyroid glands lose their connections with the pharynx. What about the fourth pharyngeal pouch? The fourth pharyngeal pouch, down here, it also has dorsal part and ventral part. The dorsal part forms the superior parathyroid gland, and the ventral part forms the ultimobranchial or ultimopharyngeal body, which gives the C cells of the thyroid gland, parafollicular C cells of the thyroid gland comes from the ultimobranchial body, from the ventral part of the fourth pharyngeal pouch. As the embryo develops, or as the fetus develops, as we have seen, you see here, the third pharyngeal pouch gives origin to the inferior parathyroid gland, the dorsal part, and the ventral part gives the thymus. The fourth pharyngeal pouch, its dorsal part forms the superior parathyroid gland, and its ventral part forms the ultimobranchial or ultimopharyngeal body, which gives the C cells. Forms the ultimobranchial body, gives origin to the C cells of the thyroid gland. So to summarize in this image, these are the pharyngeal arches from inside the pouches, from outside the pharyngeal clefts. The first arch gives these structures on the left side, as we mentioned in the previous slides. The second arch gives this, as also facial expression, as we say, the auricular muscles, the stapedius, the stylohyoid, posterior belly of the digastric. And the third arch gives this, the stylopharyngeus muscles supplied by the glossopharyngeal nerve. And the fourth arch gives laryngeal cartilages, and it's supplied by the superior laryngeal nerve. It gives cricothyroid muscles. As you see, and the laryngeal cartilages. Okay, now we have reached the end of this lecture for today, and we continue in the coming lectures. Thank you very much for your listening.